Hey everybody, Dan Hellman here from H3, and welcome to this edition of the H3 video blog. If you remember back a few weeks ago, I started a small series on video blogs that had to deal specifically with the type of manual therapy that's performed here at H3. And if you remember, my first video blog for this particular topic was on articular pumping. Now just to recap, remember I use articular pumping for a couple reasons. One, to actually pump the joint, to actually help pump fluid in and out of the joint to promote healing. And two, we use pumping techniques to actually help hydrate and to help promote healing of tendons and ligaments. It's a very gentle technique that gets amazing results. Now, in this particular video, what I want to talk about is I want to talk about the second technique that I use quite frequently, and that is TTLS, TTLS, and that stands for Transversal Tendinous Ligamentous Stretching. Again, Transversal Tendinous Ligamentous Stretching. Again, a long word. Both the pumping techniques and the TTLS techniques that I use have been designed by osteopath Dr. Guy Boyer, and in my opinion, they work amazing for manual therapy techniques. So this video blog, again, is about TTLS. Now, TTLS can be used on the tendons and the ligaments. Now, if we're going to use it on the ligaments, typically what TTLS is used for is you use TTLS on the ligaments to actually sedate the nervous system. And the reason why we want to sedate the nervous system in a particular area is because from that point we may choose to do a manipulation of that joint. So the TTLS will sedate the area that you're frictioning across. And now, if I want to do a specific manipulation of the SI joint or of the lumbar spine or of the thoracic spine, it makes the manipulation very easy and it pinpoints your manipulation. So instead of doing a global manipulation, this will be very specific. Now, the other thing that going transversally across the ligament does is it actually helps promote the healing process. Because the TTLS technique is a bit uncomfortable, what it does is it actually irritates the area a little bit, and that helps promote the body's hormonal system to send its macrophages, neutrophils, etc. to help promote healing of the area. Now, the second area that I use TTLS on are the tendons. And typically, if I'm using TTLS on the tendons, it's because I'm trying to separate the tendons. Now, what do I mean by that? Here's a really good example. A really good example would be the adductors of the groin. So you have the adductor magnus, you have the adductor longus, you have the adductor brevis, and you have the pectineus. So you have a lot of different muscle fibers in the groin area attaching all the way down toward the knee. What happens when there's a lot of tendons that are going in the same direction and crossing directions, etc., you create friction, and a lot of times if there's a friction in the area, that's an inflammation, and the tendons actually get adhered together. And now the muscles don't function to their optimum. So the TTLS technique, when you're using it across the tendons, again, actually helps separate the tendons of that particular muscle and creates better muscle function. Again, the other thing that it will do is that it will help promote healing if there's inflammation in the area by stimulating the body's hormonal system. So there you have it. That is TTLS as a definition. And now what I would like to do is I would like to show you an example of what a TTLS technique looks like. Okay, we're back, and I have my client Mike on the table, and I'm going to do a demonstration of a TTLS technique of the inferior iliolumbar ligament. The inferior iliolumbar ligament attaches to the transverse process of L5, and it kind of goes out in a fan toward me, attaching to the ilium. I'm going to go out on a limb and say that the inferior iliolumbar ligament is the cause of about 50% of all back pain. So this is a very important technique, and I probably do this technique about 5 to 6 times a day on different clients. So here again is the demonstration of the TTLS on the inferior iliolumbar ligament. I got Mike lying on his side, bottom thigh at 135, his top thigh is resting on my thigh. I need an anteriorization of the ilium to promote the TTLS of this particular ligament. So I'm going to have Mike pull his knee to his nose, but I'm going to block the motion. So by me blocking the motion, I'm going to get a relative anteriorization of the ilium. My cephalic hand is going to help promote the anteriorization of the ilium, and my caudal thumb is going to be working transversely across the ligament, the inferior iliolumbar ligament. Now the ligament goes in this direction like this, so I need to make sure that I'm going across the ligament in this direction. And for the 2 TLS technique, I start my pressure with my thumb. Mike pulls his knee to his nose. I go deeper, he relaxes, and I take him into an anteriorization of the ilium, and then I relax. I go, Mike pulls his knee up, he relaxes, and I go deeper into the tissue, and I relax. I keep doing that over and over and over again, about 15 to 20 times, and that again will do a couple things for me. That will help me do an adjustment of the lumbar spine or of the SI joint if that's what I'm choosing to do. This will also help sedate the ligament, and if Mike's having any low back pain, typically when I get done with this, his back pain is gone. So again, that's a quick example of what a 2 TLS technique is. If you have any questions regarding this technique and how it may help you, you can always call the office at 954-566-0585. You can also drop us an email at info@hellmanholistichealth.com. And you remember our motto, it's better body, better life.